an understanding of like, the general consensus and what point
Yeah.
All right, we are 30 now. You see that? Can you hear me, Adon?
Yeah, I can hear you. You can hear me? Hey, Alyssa. Class of 2021, if COVID allows. Nah, you right there, sis. Yeah, 2, 5th year.
Okay.
4th year. Finally in high school, not too early to learn about these things. You could agree with that, right, Kevin? Dr. Carroll?
That was really good.
Yeah.
Finishing
I
year.
think if I even knew about UWI really from high school, I think I would have done this differently.
Yeah, I think so too. I wouldn't have, even though I love my undergrad experience, I probably would have just did I forget what the person called, what they do.
Prelim.
Yeah, the prelim thing.
Yeah, I think I might have done that too. Another 5th year. Pedro, 5th year, 4th year. Yeah, I think I would have done prelim too if I knew. I know if my daddy knew, whew, jam. I'd have been in our first plane, first Caribbean Airlines flight out of here at 17, if my daddy knew about that, for sure.
I think undergraduate has your benefit. It has its benefit.
Yeah,
You could grow up a little bit,
yeah, that for sure. But what I would say is that not doing undergrad doesn't leave you at a disadvantage, I don't think.
No, it doesn't. It doesn't.
Yeah. Like some of the sharpest ones, like straight out of high school, like straight from Cape and everything, and then day straight. And still disciplined, like still pretty mature too.
Yeah.
Prelim, yeah, you're smart.
Okay.
I think prelim is a good way to go. If y'all know anybody who wanted to join and hasn't joined yet, just send them a message on WhatsApp and let them know that we're gonna start in a few seconds. Yeah. Hey, Alyssa.
Okay. Adon, we should probably jot this question down. Doctor, can you share how your fifth?
Yeah, sure. It's a good one.
Okay, we have 51.
Okay. Hi, Jada. We right here. Hoping power don't turn off on us or anything.
Yeah, gotta love VPL.
So good night, everyone. Thank you so much for joining us. We'll probably have a few more people join in, trickling in little by little. But if you are new to my channel and new to my face, thank you so much for trusting me with your time. Just want to introduce myself really quickly. My name is Adun Olurin, and I'm a fourth-year medical student. I started this channel a few months ago because I felt led to share my testimony, if you will, with regards to medical school, because I know that my experience is certainly a shared one between myself and so many of you, right? So I just felt that in being transparent, at the very least, people would feel seen and supported during their medical journeys. So when I got the opportunity to have Dr. Carroll come on here and talk to us, I just jumped at it because, you know, he let me know that he wanted to share what options we had following medical school and really why it's so important to just be aware of these options, right? So here we are now. Hi, Kim. So before we get started and before I introduce Dr. Carroll, actually, I just want to say that this live is for educational purposes only. Our intention is to just empower young doctors and young medical students by the dissemination of this information and through Dr. Carroll sharing his experiences. And our opinions do not reflect on any institution or any local dominion. And we're just here to support you guys and advise you guys, really. Yeah.
Excellent.
Actually, were you going to say something?
I said excellent.
Yeah, thank you. So I actually know Dr. Carroll because he graduated high school with my big sister. So I think the last time I've seen you in the flesh is 2006 at your high school graduation. So it's been a long time, but
Putting
I have.
out there.
Huh?
Putting my age out there.
No, you good. But I've been stalking him on LinkedIn and Instagram, and I'm just inspired by, you know, the things that he did after graduating high school. So just seeing him graduate college, like graduate undergrad and graduate med school with honors, distinction, and then going on to become a member of the Royal College of Surgeons. And he just recently matched, which is super inspiring and it's really encouraging. So I think it just tells us all that this is actually possible. You can do this. You know, I might not graduate with distinction, but at least I'm from Freeport, so maybe that'll help me a little bit in my end. So it's just encouraging to see someone accomplish that. So Dr. Carroll, thank you so much for joining us tonight, taking time out of your busy schedule to impart some knowledge on us. So thank you so much.
No problem. Thank you for the introduction.
No problem. So I think we have a good amount of people again. Thank you guys so much for joining. If you're just joining, this is Dr. Kevin Carroll. He's going to be sharing with us the different options you have after graduation from med school and sharing with us his experience in the match. So if you know anyone who would benefit from this information, go ahead and share this link. Feel free to share it wherever you want to share it, Twitter, Instagram, Facebook, WhatsApp. So we're just going to get started then. Dr. Carroll, thank you again. Can you tell us why you decided to apply to the US match after having already been, you know, in postgraduate studies after graduation, and why you think it's important for us to be aware of this option that we have?
Okay. Yes, I'm actually still currently a second year in cardiovascular. But I decided to withdraw the program because I matched into general surgery in the US. The reason why I applied to general surgery in the US is the timeline is a bit lower in terms of from start to finish and how long it actually takes to become a surgeon in the US. In the Caribbean, there are, you know, restrictions as well as some institutional problems in certain places where you don't get the exposure that you need. You will get it over time. Don't get me wrong. You will get great exposure in the Caribbean, but it tends to take a little more time than usual because you can't accumulate the amount of cases you need to do and what you're exposed to in that 5 years of general surgery. So that's one of the reasons why I applied to the US, because programs tend to be straightforward. You finish in time, and you're exposed to like peripheral medicine. So also robotic surgery. I want to be the first Bahamian robotic surgeon.
Nice, nice.
I decided to pursue surgery in the US so I could be exposed to that early.
That's nice. Yeah, I definitely understand that. So someone is asking, how long is this stream gonna be? So Dr. Carroll, I think you said about an hour, right?
Well, it depends. It depends on how deep we get into the conversation, as well as talking about all the different ways. It can go.
Right. Okay, hopefully that answers your question. So I got a lot of questions through Instagram. Oh, someone is saying that it's difficult to hear you.
Oh, try to use your headphones again. I think you may be echoing.
Let me see. Okay, is that better, guys?
Do you still hear the echo? Can you hear me, Adun?
I can hear you, yeah.
I think the echo is gone now. I don't really hear anything.
Okay. Is that better from my side, guys? Much better, better. Great, 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 great. Awesome. Thank
Okay.
you. Do you
Nice.
want them to go back over that part then?
Can everybody hear me better? Yeah, I think the general consensus is
It's good now.
yeah. So I think you were echoing. So yeah. So if you guys didn't hear me, basically I wanted to go to the US. So I'm just going to give a quick summary of what I said. I wanted to go to the US to be able to finish my training a bit faster. In the Caribbean, it tends to take a little longer than the US. So that was one of the main reasons why I decided to pursue surgical training in the US. Also, I wanted to be exposed to robotic surgery. And that's not in the Caribbean as yet. And I'm trying to become the first Bahamian robotic surgeon. So that's something that I'm really trying to get on top of. So that's where I'm at right now. That's why I applied to the US for postgraduate surgical training.
Right. And you said something about the program lengths being a little different and being able to get more exposure over
Yes.
there, you think?
Usually general surgery training in the States is 5 years. Sometimes 6 if you have to do a preliminary year. It depends. But in the Caribbean, you can finish it in 5 years, don't get me wrong. But there is possibly going to be a delay at times because of, sometimes you don't get the amount of cases. Sometimes your surgical skills may take a bit longer to improve. And that's one of the main reasons why I wanted to leave the Caribbean, so I could finish surgery in a timely manner and, come out to my country and be able to provide a service.
That's nice. That's good. That's good. So I got so many questions through Instagram about your match process. I mean, so many, I don't really know where we should start first. But yeah, that was actually a big question. If you completed any US clinical experience prior to applying to the match, and if you think that's necessary even.
Okay, so when I was applying to the match and when I reviewed the program requirements for most of the programs, they would say that you were required at least 3 months, 6 months, sometimes even a year, up to 2 years of US clinical experience. Now, obviously, that's not feasible in our setting because how are you going to get that much time off from your current program to do US clinical experience?
Right.
With that being said, I still applied to some of those programs. I still got interviewed at some of those programs without having US clinical experience. But I kind of did other things to somewhat mimic that. So I went to a lot of US-based conferences, like the American College of Surgeons in San Francisco last year. I went to Society of Laparoendoscopic and Robotic Surgeons in 2018, excuse me. I went to a thoracic surgery boot camp in North Carolina last year, as well as I did a course in Chicago for general surgery residents. So it's things like that I did so I could build my CV. And I knew that would be the closest thing I can get to US clinical experience. So that's why I decided to try to do that and just use things to build my CV and improve, you know, how I looked at as a whole general applicant.
Nice, nice. So on that same breath, a lot of people are concerned about research. I know I don't want to do any research. I mean, I don't want to say it like that, but on top of the workload that we have, I've gotten a lot of comments from followers on Instagram saying that they are not interested really in doing any research. Do you think having that research experience or participating in research, do you think that's necessary to apply to the match, or if that would be better for your application?
So you can get mixed responses about that. Some programs say that they would like for you to have research. Some programs don't necessarily focus on that, but they would expect you to do research at their program if you get accepted. Now, I did do research at the hospital that I recently resigned from. So I did have some research there, and I did research in my undergrad as well. So I had minimum research, but I still got interviews and I still got offers. So yes, it helps with the application process. Now, if you have like 7, 8, 12 published papers, then obviously that's going to stand out. That's going to help. And if they're interesting, you know, groundbreaking research, that would always be a plus to improving you as an applicant. So honestly, yes, it does help. Is it entirely necessary? Maybe not, but you have to build your CV at this time. While you're in medical school and even after medical school, when you're actually training at whatever hospital that you work at, once you get on research and you do these things, it's going to improve how you generally look as an entire applicant. So I think you should definitely get involved with research, especially during medical school.
That's good. That's good. So just really quickly, I also got the question about ECMFG and the certification process and the eligibility period. I think even for me, it's a little confusing. And basically the timeline of that, how long does that certification take and everything like that?
Okay, so usually with the ECFMG certification, that's a certificate that you get after your medical credentials are verified and after you complete step 1, step 2 CK, which is clinical knowledge, and step 2 CS, which is clinical skills. Now that's the 3-step exams that you're required to take when you apply to the match. So once you complete those exams and pass them, and you get your medical credentials verified by the ECFMG, and that's done through the university that you attend or the university that you graduate from. Once everything's in order, they'll send you your certificate within a week. Now, with that being said, it is good as an international medical graduate to be ECFMG certified before you apply to the match. I was not ECFMG certified before I applied to the match because I took step 2 CS, that's the OSCE. I took that about a week or 2 before the applications went in. But you can have your ECFMG certification outstanding before the rank order list, which is in February. So with the match, you apply by September, but they're changing the dates because of COVID. So I think the application deadline is October 21st for this year for whoever is able to apply this year. And the rank order list usually is in February. So once you complete all of your USMLEs by February and get ECFMG certified, you'll be okay. But it is better to be ECFMG certified before the match, before you apply, because some programs won't consider you if you're not certified. But just saying, I was not certified by the time I applied, and I didn't get certified until the end of October last year when I applied to the match. So, and applications went in September 15th. So it's not like set in stone that you need to be certified before you submit your applications, but you definitely need to be certified before February, before the rank order list. So you, you should have at least step 1 and step 2 CK definitely done before you apply with CS outstanding. That's something to consider, but I don't really recommend that. You should have everything in order. You don't necessarily have to, but you should before you apply, just to improve your chances.
Good. That sounds good. So Alyssa is asking about the conferences you spoke about a little while ago. Were you able to attend because of your previous employer, or did you apply independently and take vacation to go?
Okay, so at my previous place of employment, you are eligible for a week conference leave every year. That's something that the employer recommends, and they would even cover you up to $1,000. So once you keep your receipts, you pretty much set everything up for yourself. You apply for like the membership to the association that's conducting the conference, and then you would basically pay to go. Sometimes conferences are free for students as well as residents, and they would consider you a resident even though you may be postgraduate and not necessarily in a training program. So you can get conference leave and you can go, and they would allow up to a week off.
That's good. That's good. So when you were picking your programs, another question we got from Instagram, thank you guys for these questions, by the way, sending them in advance. But one of the questions we got from Instagram was, how did you decide which programs you were going to apply to? And how did you know which programs were international student friendly, so to speak? How did you come up with that list? And how many schools did you apply to?
All right, so there's a online resource called FRIEDA, FRIEDA. It's pretty much covered by the American Medical Association, which is an association that I recommend everybody apply to. They can definitely get a free membership to that, and that has its benefits. So what it is, it has an interactive resource where you could search by state which programs are available. So general surgery, for an example, if you click Florida, it would have a list of all the general surgery programs in Florida, and it would specify whether it's IMG friendly or not.
Nice.
And it would also have details on the score requirements, the minimum score requirement, as well as the percentage of IMGs. They would have whether it's a research predominant program versus a non-research predominant program. They would even mention whether or not, well, no, we're not going to get into that. Never mind. But
okay.
Yeah, but that's a good resource you can use. I personally applied to about 220 programs.
Wow. That's a lot. So you mentioned score and how some programs have like score minimums, but I know for 2022 that ECMFG and NBME, they're going to get rid of that score, that numerical score for step 1. So I actually have a question. Do you think it's better for us to hurry up and take it in 2021 so we can get a numerical score, or is the pass-fail method going to be beneficial to us? I've seen mixed reviews, so what do you think?
There's a lot of mixed reviews about that, but I personally do not like the change. I could be wrong. This can be argued, this can be debated, but I personally think that they should leave the numerical system. The reason why I say that is, as IMGs, we're also always going to be at a deficit, for multiple reasons, whether programs are not interested in sponsoring visas for IMGs or just the hassle of getting them to actually go through all the documents in the process of onboarding and getting into starting residency. It's a hassle, it takes time. So it's a lot of stress. So you can kind of see why some programs would not be interested in IMGs. But the US is very fair with their training programs, and they honestly create a possibility for us to train in the US compared to some other countries that we can mention later on. But I personally think the numerical system would be able to set us aside from the other graduates. As you know, it's common knowledge that we should score higher than the US graduates, because the way these programs assess you as a candidate, they have an algorithm, and they assess how well you do, their score requirements and whatnot. So you should score higher than the American medical graduate. But
Yeah.
even if you fall short with your scores, that's not set in stone in terms of you actually getting into a program. You have to do things like research, like US clinical experience, even if you could take a month or a few weeks or do one of your 4th or 5th year rotations, or do other things to set yourself aside from the others. Like go to conferences, go to meetings internationally, present at these conferences and meetings if you could. All these things build you holistically and build a good entire applicant. So you could pretty much step up if you fall short in some areas and be able to match to your program.
Right. So we got a question a while back. You said still again on the conferences. We got a question a while back from Kishelle, and she's wondering, how do you even know about conferences? How do you know that they're going on, and how do you become a part of that and present?
So it depends on your specialty of choice. So if you're interested in surgery, you join some societies, like the common one, like American College of Surgeons, or the other ones that are a little bit more subspecialized, like robotic surgery societies or thoracic surgery societies. And once you sign up and you do their free membership, they would send you emails and constant updates. And most of the big places like the ACP, that's the American College of Physicians, and ACS, American College of Surgeons, those are definitely societies that you should be involved in. And they're going to send you email updates on when they do their annual conference. And these conferences are usually always once a year. Now, I don't know how it's going to happen with COVID, but definitely they do these conferences once a year. And they're very, very, very beneficial. Like I actually met my program director before I interviewed at Morehouse at a conference. We were doing, they were doing like a program director versus incoming resident speed dating thing, where you would talk to the program director and get advice. So the first person I interacted with was my program director. And we hit it off. We had a good conversation. And then he asked, like, what am I doing? I told him I'm a resident in the Bahamas. And he said, if I was interested in coming to the US. And I said, yeah, I actually interview at your program next week. And he's like, okay, good. I'll look out for you. So those little opportunities could be life-changing, you know.
Yeah, I can imagine that.
As an IMG, networking is the most important tool you have, okay? Networking holds more strength, in my opinion, this can be argued, than scores, than research, than US clinical experience. Once you're able to communicate with people, meet people, you can really excel. And people really—
That's nice. That's good. Y'all writing this stuff down? So we have a few more questions regarding your journey on the whole. So I don't know if you would be willing to share more details on your scores or anything like that.
It's common knowledge. We don't talk about scores.
Okay. So no scores, but another thing. So people want to know, how many interviews did you get? So you applied to 220 programs. How many interviews did you get?
I got 6 interviews, but at 3 of those interviews, I interviewed for both categorical and preliminary tracks. So essentially it was 9, but there was 6 different programs. And that goes to show how competitive surgery is, just using me as an example for surgery. Some specialties have more positions, like internal medicine. So a lot of internal medicine programs take IMGs. Now, I'm not saying it's easier to match into these other specialties, but certain specialties are known to be competitive. And that's because of the amount of positions they have available. So if you compare IM to surgery, IM has about 9,000 positions. Surgery has 1,300. And obstetrics and gynecology has about 1,100. I think anesthesia has less than that. Dermatology has less than that. Thoracic surgery only has 27 positions. So as you get more subspecialized in certain areas, it's very, very competitive. So yeah.
I had a question actually from Instagram about how competitive these programs are, and someone wanted to know like the ranking between amongst the programs in terms of competitiveness or difficulty. So do you have like a general response? I know like my first aid book, for instance, does have like a chart, and maybe I can share it on my Instagram later, where they rank the programs in terms of score and the average score of the applicants that actually matriculate into those programs. So maybe that's something I can share, but what do you think about that generally?
So generally, I don't really want to give any numbers. It really depends on so many different factors. But they're in first aid, and first aid for you for step one, they do have ranges for different specialties, and these things change every year. If you search the NRMP match, that's the National Residency Matching Program, they have reports post like after the match every single year on what specialties went matched, what specialties went unmatched, and the average scores that match to those specialties for step one as well as step two CK. So you can look at that. That's on the NRMP website. We could share that later. But it goes up every year. So general surgery, it would go up. Internal medicine would go up. And these things change all the time. And, you know, as the years go by, the students, they're pretty much figuring out these exams and how to prepare for these exams and study. So the scores are generally getting higher and higher, and it's getting more and more competitive every year. So that's why.
Yeah, that is for sure.
I personally think everybody should jump on step one before they switch it to pass-fail, just to set yourself aside as an IMG, just so you could have another numerical score to, you know, try to outshine the American colleagues, so you can actually improve matching.
Yeah, that's good advice. Thank you. And I guess we could just roll right into talking a little bit more about the USMLE. You spoke about trying to get it done before we're done with med school. So do you have like any advice on a general timeline we should keep in mind? Like how many months should we study? When should we take step one and step two and all these different things? Step three is a thing too. So
Yeah.
what advice do you have on that? I'm seeing a lot of questions about that.
All right, so let me just say everybody is different, okay? Everybody studies differently. Some people need more time, some people need less time, okay? And everybody's style of studying is different. So I'm not going to go into the details of how to study for each of these exams, because you can find this in YouTube, and all of these methods tend to be effective if you do it properly. Now, for me personally, for step one, I took about 7 months, and 6 of those months were while I was working. And then the final month, right before I took the exam, I took unpaid leave from my last place of work to do some final preparation. I studied for CK maybe 4 to 5 months, and then CS I studied for about 2 weeks.
Nice.
And I'm actually currently studying for step three. Step three isn't a requirement before you enter the match. It would be beneficial to have it. Some programs for IM actually request that you have it before you enter the match for the IMGs, but you could research that and find out which programs those are yourself. But you don't necessarily need to complete that until your first year of residency. But I'm trying to personally get it out the way just so I could focus on my in-training surgical exam when I get into residency.
Right. So someone is asking me, so you're prepping for step three now to get it out of the way before you start your program. Yeah. So Misha is asking, considering that we're in a pandemic, when does your program even actually start?
It starts on time. So I have to be there by July 1st. That's my first day of work. I actually have to be there earlier for orientation, and they're expecting us. So there's certain, stipulations in place to allow like essential people to travel. So I would definitely be able to travel to the US when I'm ready. So everything seems to be starting on time. They're just a lot of the onboarding and the preparation for the new residents, to do it in respect of COVID. So social distancing and whatnot. And we've been having a lot of Zoom work meetings and stuff like that to prepare us. So yeah.
That's good. That's good. It's good. So travel mercies to you. We'll be rooting for you. We're all rooting for you. So Misha's asking, when did you actually take step one? Was it in your intern year, SHO, or during your postgraduate studies?
I actually took CK during my first year as an SHO. And I took step one. So I did CK first. And then I did step one during my second year of SHO, and that was my first year as a resident. So yeah, and then CS I took it during the beginning of my third year as an SHO.
Nice. So while we're talking about that, so you did all of these basically while you were working and super busy. Besides that 1 month that you said you took unpaid leave to get in some more dedicated time. Now, what do you recommend for us? Would you have done it differently? Do you recommend dedicated time off studying, or do you think you can do well while you're working or while you're in school studying for these steps?
Yeah, step one is a beast, okay? That's a serious exam. That's probably one of the hardest exams I ever took. So if it's possible, for me, I would have changed things a bit differently. I would have tried to, or attempt to take it during medical school. If I knew, and that's why I wanted to do this forum with Adun. I did not know a lot of these things when I was in medical school, not even up until my 5th year. I wasn't aware. I just knew about it. I knew it's something that we should do, but I didn't realize how important it was until I started working and realizing that I needed to transition so I could actually train a bit faster. Now, in terms of taking dedicated time, I think that would very much help you, because step one is a serious exam to study for. It's a lot of work. It's a ton of work. So I think it's definitely helpful to take some dedicated time to prepare for it.
Okay, I'm showing you in the screen.
Can you guys hear me?
Okay.
We need to go through this comment section too, because I think a lot of questions are coming through here and we're not tackling all of those.
Yes, coming in fast too.
Yeah, I think it's something from your end, because we're still very good. I'm still very good on this side. Oh, okay. So, sorry guys, Adon is having some technical difficulties, but I can continue to speak on some things. I see Doctor Before Mistress is constantly asking about PLAB. I actually did not do PLAB, but I'm going to talk about that in general. But I did do the MRCS, and I am currently registered with the GMC, the General Medical Council. And I can talk about how I prepared for the MRCS if people are interested in surgery and the routes you can take to get to the UK. That's going to be the next discussion. But everybody seems to be interested in the US route. No problem. We'll tackle as much as we could. But I guess I could. Did you guys hear everything I had to say about the USMLE and all that stuff? Yeah, I can see the comments.
You still can't see me?
No, I can't see you. It. Sorry, guys, I'm on the phone with it doing. It did like a split screen just now, and then it went back to, okay, it's doing the split screen now.
Yeah, I'm doing like split screen, but
Try to turn your camera on.
yeah, I turn it off and turn it back on. Let me just remove myself. Okay.
At Greg and E. Cooper, it was very expensive applying 220 programs. I probably paid about $6,000 just for the application.
Oh, dang it.
So it's with, I guess we could talk a little bit about cost too. This is a very, very costly journey. Okay, it's very expensive. So you guys have to be aware about that too. For some reason, the STEP exam seems to be going up in prices every year for IMGs. I think they're currently at $900 for Step 1, $900+ for Step 2 CK, and about $1,600 for CS. The CS is changing because of COVID. So I'm not sure what's going to happen with CS. I don't even want to talk about CS much because when I did CS, it was a 12-station OSCE with 12 simulated patients, and you would go in, you take a history, you examine the patients, and then you come out and you write a note. But that's changing because of COVID, because of social distancing and all that stuff. So I can't comment much on CS, but it was $1,600 when I took it. At Paige Armley, I hope I pronounced the last name correct, $6,000 was for applications alone. If you guys ready for the final tally on what I paid for the whole match process, including my USMLE exams, I probably spent over $20,000 easily.
Okay, I think I'm back in.
Yeah.
Y'all could see me and hear me again?
Yeah, I can hear you.
Woo! Could see me?
Yeah, I can see you.
Great.
Usually when you apply, the first 30 programs is about $400+, and then every program after that is about $25 each. So yeah, yes, 20K. That's right. And I actually lost track of the amount of money I was spending because you remember you have to pay for resources. UWorld is not cheap. UWorld can cost $300, $400, maybe even $500, depending on how long you get it for. You have to pay for the textbooks. You pay for other resources that you may find helpful, as well as the applications and the travel. Yes, I paid $20,000. That's when I lost count. I stopped counting after that because it was getting stressful really.
Yeah, I could imagine that for sure.
Self-funded, no sponsorship.
Yeah, that's crazy.
So for you to do all of the exams and everything and progress in your training, you have to make a significant investment in yourself. And when you're done, when you're a specialist doing whatever, the money will come back. Trust me, the money will come back. So you just have to prioritize what you need to do now to get to your training. And yeah, don't let cost be discouraging doctor before nurses. It's an investment. You don't have to apply to that much programs. I applied broadly. It's recommended that IMGs apply broadly, but you don't have to apply to that much programs if you don't want to.
Yeah, someone is asking if I hear that. I think I can't actually type in the chat anymore. I'll have to switch back and forth through the windows because I had to like add myself back as a guest.
Oh, I can't type in the chat at all.
No? In the host chat? Yeah, for some reason, as a guest, we can't type in the chat, so we'll have to just respond out loud. I'm happy y'all can hear and see me again. Thanks to those who called me. I made sure I was reconnected.
If we miss your question because the chat is so active, just repeat the question and we'll try to get to it.
Yeah, for sure.
Yeah, but I was speaking about costs. So that's how much I paid for my personal journey. I know some people that paid more because people applied to more programs. I know some people that applied to over 300 programs. So it's an investment. It can be very beneficial and make you the happiest person alive, or it could be very disappointing too. You have to be realistic. Some people do not match, unfortunately.
That's true.
So you really have to put your neck out there and just try if you want to pursue training elsewhere. So someone else asked when I did step one. I did step one during my second year as an SHO in, I think, April 2019. That's when I took step one. Step two in August 2019, and CK was in 2018.
Nice. Does anyone have any more questions on the US route and USMLE? Or would y'all want to move on to talking about DM programs in the Caribbean or PLAB or the Canadian route and everything? Just let us know. Were you ever discouraged to not pursue medicine?
Next question. Sorry.
Next caller.
I applied to thoracic surgery other than general surgery, the 27 programs. Like I said, it's very competitive. I did not get any interview offers. Yeah. Was my graduation date a huge factor for programs? Some programs specify that they don't want candidates that are 2-3 years out. It depends, but most of the programs generally say if you're more than 5 years out, then that's going to be it may be an issue. It's not set in stone. I know some people that are 10 years out of the match, so none of these things are really set in stone. These circumstances changes all the time. Remember what I said, you have to set yourself aside from the others and make yourself marketable, but nothing is set in stone.
That's good. So some people are still asking a few US questions. I think we already covered the resources for STEP. I know you said that you'd recommend just going on YouTube and finding out what people said works best for them. What worked best for you think?
So for me, it was UWorld First Aid, Pathoma, that's a pathology reference. I also used something called Boards and Beyond. It's a video online website. You have to pay for it. And they have about 450 videos on biochemistry, behavioral science, microbiology, pathology, basically everything you need for step one. As well as some people use Kaplan. I heard that's good. I didn't personally use it, but I got some good remarks from some of my colleagues that use Kaplan. But that was pretty much the backbone of what I did. UWorld First Aid Pathoma. I dabbled with Golden a little bit, and I also use Boards and Beyond religiously. Like that really helped to increase my score by about 20 points or something like that. So, and then you have to do practice exams to gauge where you're at. And usually, not usually, but NBME, that's the National Board of Medical Education, they have practice exams for step 1, step 2 CK, and step 3. So you can take those exams to gauge where you're at, get a rough idea and a rough score. And then as you study and improve, and you repeat taking these exams, you should see an improvement in your score. If you don't, then you have to do things differently. And that's when I would say Google other resources, because everybody studies differently. Everybody did things a bit differently. Step 2 CK for me was online med-ed. I actually read the first aid book for Step 2 CK. Mastering the boards for Step 2 CK was really good. but it was mostly UWorld for CK for me. And step 2 CS, you only need the first aid book. But remember, CS is changing, so I don't know what's going to happen with that. Let's run through some of these questions again.
Yeah, I'm looking at some of them now. U.S. letters of recommendation. Did you get any U.S. letters?
Yeah, I got 2. So you need about 3 to 4, minimum 3, 4 maximum letters of recommendations. I had 2 U.S.-based surgeons, 1 U.S. trained surgeon that's currently in politics, and UWI trained surgeon. So I got all those from my references. But 2 were US-based. One was at the Cleveland Clinic and one was at Orlando Health.
And how did you get into contact with those people? Was it through the conferences you attended, networking through those things, or?
I knew 3 personally, and I got to know 4 during my whole USMLE journey and matching and stuff. He kind of mentored me along. I actually didn't physically meet him until after I applied, but he liked my character and whatnot, so he still wrote me a letter. And he also specified that he did not, or he never worked with me. They tend to be in the US, and people appreciate that. But he saw other positive things that he thought was reassuring.
Nice, nice. I wonder if we missed any other questions about the US route before we move on.
For the NBMEs before step 1, I didn't take all. I probably should have taken all, but I took probably 4 or 5. How did you study around work? Oh, that was rough. So I worked in the Department of Surgery. That schedule is a bit intense. So what I did was I read or did questions in between cases. I would leave work after maybe an 8, 12-hour day and try to study as much as I can. There's been times when I left work after a 53-hour day and still tried to study. So these things, you really have to prioritize what you want. And you got to hustle. Is a hustle, and you have some of us have to work because this is a very expensive process. So some people have to work and study to be able to afford all these things.
Yeah, for sure, for sure.
At Mike Ann, I only have 2 publications. One is medical, one is environmental. Can you give your experience attending UWI Mona? If you could go back, would you have chosen one of the other campuses? It's a political.
No, I wouldn't.
My experience at UWI Mona was good. It was a good experience. My experience in Jamaica was amazing. I love that country. I would not have chosen another campus, but I never really went to Barbados or Trinidad, and I've never been to the campus, obviously, so I can't really comment on those campuses. My colleagues that are very great and very bright went to those campuses, and they are doing very well. So I'm sure everything is, pretty straightforward. Everybody does well.
Evens out. Nice. So Greg and Nick, sorry I missed your question earlier, but she wants to know, how did your interviews go and what were the common questions during your interviews?
So someone asked if I ever experienced in CARPA. No, let me just clarify that. Or ever participate. The interviews were interesting. They were very interesting. One of my interviews, the guy told me when I walked in the room, he doesn't care about scores. He doesn't care about what I do. Tell me something interesting right now. So I was like, okay, well, I told him I hunt boar when I go to Long Island to visit my family. And that guy fell in love with me because, he was an American guy. And some of them really enjoy hunting. So we spoke about hunting the entire time during the interview. And at the end of the interview, he told me he really likes me. So, and they score you during your interviews. I want you to remember that. They score you against all the other candidates. So they can ask you the weirdest thing. They can ask you just normal questions about, tell me about yourself, or why do you want to do medicine in the US and whatnot. But it could be completely straightforward or it could be completely far-fetched. there's a lot of resources online that show typical questions on what you can get asked in residency interviews. So you guys can find that, but it could be almost anything. And I want you to know, this is something I didn't realize until I got there. It's not just one interview, at least for surgery. At one program, I interviewed 6 different times. At another program, I interviewed 3 different times with 3 different attendings, or sometimes 2 attendings at a time. Sometimes 4, sometimes 5, sometimes even 1. So it depends on the program. And I just want you guys to keep that in mind. They really vet you, and they really try to get a good understanding of you, because they don't know you. You're coming from Caribbean, or from India, Pakistan. You come from anywhere, and then you come from other states if you're an American graduate. So they really don't know you, so they could ask you almost anything.
That's true. So you found yourself flying back and forth a lot, one interview, then come back home, and then fly back for another one, even within the same program.
Yeah, so one week I had an interview at University of Miami, and then Howard messaged me like 2 days saying, we need you to come for an interview a day later. So I had to fly back home, do a call, post-call, fly to Washington, D.C. to do an interview. So it gets pretty busy, and the interviews can just pop up at any time.
And no virtual interviews. Alyssa's asking, no interviews would be.
I had one virtual interview at a program in Detroit, and that was because they were snowed out. So it was during winter, so they couldn't really risk people flying in. So they did a Skype interview, and it was pretty good.
That's good. Well, good. So basically, they expect you to fly. Like, if they're not able to accommodate you, that's different. If it's snowing or something, that's different. But if they need to see you, they expect you to fly out and show up for sure.
Yeah, but I think that's going to change because of COVID. So I'm not sure, but they may switch things to online-based interviews rather than in person. So I think a lot of things are changing this year because of what's going on. Someone asked if they have clinical scenarios. I never got a clinical scenario question at all.
Good. That's good. And I think by then you shouldn't be asking about no.
But some places do, though. Some places do. But I never got a clinical scenario question.
Yeah, I think they'd be wrong for that after all that time. So that's really good. So people are still asking about time off.
Yeah.
What time off from your previous employer for interviews?
So I took casual days. That's something that my previous employer offered me. You can take, I think, up to, well, it depends. I don't really want to get into the details of that. I don't know if it's safe to mention those details, but I took casual days to go to the interviews. Or sometimes I may have spoken to my senior and asked permission to be excused for a day or 2 to do the interview, and they were understanding.
That's good. That's good. That's good to hear. Encouraging. So one more person. Oh, sorry. Go ahead.
Someone's asking, as a sponsored Bahamian med student, do I have to return to the Bahamas right after I graduate? UWI? I'm not entirely sure on that. I know that at some point they made you guys sign something, like a document or something like that. I don't know the stipulations behind it. I didn't personally have to sign that during my medical school stay, so I can't really comment on that. Maybe someone else in the comment section could comment.
So for me, I'd signed a contract, and everyone in my year had to sign a physical contract. So it might be a little different for my year and beyond. I'm not sure if the year before me had physical contracts, but my year for sure, we had to fly home and sign contracts for sure.
Okay. So
yeah, so it might be different for us in that way, in that regard.
So are they requiring you guys to do any time?
Yeah, so my contract, and I spoke about this in a video about how I pay tuition, but my contract states that for every 1 year that the Bahamas government pays my tuition or pays that portion of my tuition, I owe them a half a year in service. So being that the program is 5 years, I owe them 2.5 years of service. And in my contract, it actually states that I must report in June of 2022 to serve out my contract, to serve out my bond period, is what my contract says. So if anyone actually needs to see that physical contract, I know a lot of people didn't get copies of their contract. I have a blank copy if you would want to see that. So definitely reach out to me and I can get you that blank copy, especially if you're in my year. So we would have had the same contract. So it's definitely good to look over it and see what exactly they're outlining for us in that contract. So I even had my sister look over it, right? So it's really important to know what it is that we signed on to, for sure.
Okay.
So Misha says 2019 was the first year.
All right. So, well, if you guys sign a document, you may have to respect that. So with that being said, respect it, but that doesn't stop you from preparing or making a plan on what you're going to do next. Okay?
Certainly, certainly.
So a lot of people are asking for PLAB now.
Yeah, PLAB. I think we should definitely, someone said, let's talk about PLAB before the current turn off or before we get disconnected again.
All right, so PLAB is basically the Professional Linguistic Assessment Board. It's an exam for IMGs to apply and work in the UK. It's only for IMGs. The UK graduates, they don't take this exam. They just start working in the foundation program directly after they finish medical school. So PLAB is two parts. The first part is MCQ. I think it's 180 questions over 3 hours. And the second part is an OSCE. Abby's a lawyer?
No, not Abby, my other sister, Yemi. Yo, not Abby.
And the second part is OSCE. I think it's 18 stations. Like, just like UWI OSCE, cardiovascular exam, respiratory exam, whatever. I personally didn't do PLAB. I'm going to tell you why, but PLAB is a good route you can take to get to the UK. It doesn't mean you're getting into a training program in the UK. I want you to understand that, but it will give you something called a foundation year 2 job. You only could qualify to sit PLAB after you graduate. You cannot sit it during medical school. Like the USMLEs, you can sit them during medical school, but PLAB, you only can sit it after you graduate. And the UK wants to see proof of internship completion. So you would have to do internship in the Caribbean or wherever you can do internship after you finish medical school. So for PLAB, well, for you to apply to the UK, you need to pass PLAB and have a internship certificate, which our hospital in the Bahamas offers once you complete internship. Now with PLAB, you have to understand the different grades of training in the UK. Now, in the UK, they have something called a foundation program, which is 2 years. Then they have core training, which is 2 years, depending on the specialty. Then everything after that is higher training or specialty training. So foundation year 1 would be their equivalent of internship. So obviously when you finish PLAB, when you finish internship and you apply, you would start at foundation year 2, which is essentially your first year as a senior house officer. And then after you finish foundation year 2, you could continue working as a trust grade, which is what they call their hospitals in the UK, a trust grade physician or an SHO, or you can apply to core training. Now, this core training could be general practice or family medicine, anesthesia, surgery, medicine, pediatrics. And core training is usually 2 years, but it changes depending on the specialty. And after core training, you would take a membership exam, which is what I took. I took the membership of the Royal College of Surgeons, which is a 2-part exam. The first part is a 5-hour basic sciences and principles of surgery paper, and the second part is how long was that exam? It was a 4-hour, it was a 5-hour OSCE on surgical things. So they'd have you doing surgical procedures, like for me, I had to put in chest tubes and drain an abscess during the OSCE and stuff like that. So when you do the membership exam, that qualifies you for a higher training, the specialty training. So usually after core training 1 and 2, you would enter specialty training 3, which is the registrar. So when you do a membership exam, you qualify to be a registrar, okay, in the UK. So someone said core training is now 3 years. Yeah, these things change all the time. Honestly, I can't keep up, but I can tell you that PLAB is a good route to take. So once you get over there, you can, start building yourself, building your CV, start studying for your membership exam for whatever specialty you want to get into, and try to apply for one of their training programs. There's so much different tracks you can take. That would be a very prolonged conversation for this forum, but that's something I would recommend you Google, and they have timetables and algorithms on what to do as an international medical graduate versus a UK national. So when I said that, like being a UK national, obviously if you are an American or a person from the UK, that's what you're going to be prioritized. They're going to prioritize hiring the Americans or the UK nationals. So these things help. I think the Dawn froze again. 1 second, guys. Sorry. Yeah, you can actually, Deanne Adley, you can actually take, you qualify for PLAB. Oh, sorry guys. You qualify for PLAB or a membership exam once you have a primary medical qualification, which is your MBBS. So even though you're probably not going to have any experience in internal medicine, you can still attempt to sit those exams, being in the internship. They're not going to stop you from taking those exams if you don't have any postgraduate training. But they recommend that you do, because the chances of you passing could be affected. We can see you again. Yeah. No, Deanne Adderley, when you pass the MRCP, that does not make you a specialist. It gives you a postgraduate, and MRCP is a membership of the Royal College of Physicians. That's the UK-based exam you do to get into highest internal medicine training. So it's the equivalent of being a registrar once you have that qualification, but you still need to have evidence of previous training in these specialties before you apply for that position abroad. So with that being said, no, you're not a specialist when you get your MRCP, that's for internal medicine, your MRCS, that's for surgery, or your MRCGP for general practice, or your MRCPCH for pediatrics, CH is child health. That doesn't make you a specialist. It makes you eligible to apply for higher training in those different specialties in the UK. And it's a post-nominal, so once you get the qualification, you get to put those initials behind your name. And it looks good on your CV. So these societies in the UK, you have to pass these exams to join them, versus in the US, like American College of Surgeons or American College of Physicians, pediatrics, you can just apply as a resident or a medical student. You don't have to pass any examinations. What about if you have permanent residency? Does that give you the same privileges as a US citizen? No, permanent residency doesn't give you, I don't think it gives you all the privileges of a US citizen, but it would definitely, I think personally it would help you to be considered for interviews, because you wouldn't require any visa and all that other stuff. All right, so I think they do prioritize the UE graduates for internship positions, but I've done internship with people who did not go to UE, and I've seen and worked with interns that over the last 4 years that did not go to UE. So I don't think there's like any set in stone prioritization. I think it's still possible for you to have a chance to get an internship here, for sure. But Dylan, are you there? Or are you frozen? All right. All right. Let's see. Yeah, everyone came about. Sorry, guys. Are there UK equivalent conferences like in the US? Yes. So you have to join these societies. So even though some of these societies require you to do the examinations to be a part of those societies, like the Royal College of Surgeons, the Royal College of Physicians, the Royal College of obstetricians and gynecologists, you still can get affiliate memberships as medical students or even as residents. Meaning you pay a small fee and you become a member, you get some of the benefits, not all of them, and you still would be informed about the conferences that they have every year. So every country tends to have conferences. Europe has a lot of good societies, especially for thoracic surgery. They have really excellent societies. So you can definitely go to conferences in France, England, Scotland, Germany, even in China and Japan and stuff. They have all kinds of societies across the world. Resources for MRCS. Also, I see there's a professional portfolio certificates awards that the UK requires. Do you know about that? Yeah, so when you apply for core surgical training, as well as higher surgical training, they're gonna want you to have a portfolio. And you're gonna have to build that over time from medical school up until your postgraduate training. So that would be letters of recommendation, certificates like certain courses like BLS, ACLS, ATLS. They have their courses in the UK like CRISP, that's care of the critically ill surgical patient. They have basic surgical skills. Conferences, they give you certificates. Your awards, you get certificates. So you should build this entirely over your training because they're going to want to see that. They're going to want to see how well you did in the MRCS as well as any other examinations you may have taken. I don't know what's going on with Adon's Wi-Fi. Do I believe that the US route is harder than the UK route? Are you a member of the MRCS? Yes, I am a member of the Royal College of Surgeons. I recently passed the final exam in February of this year. So I'm a full member, I'm not an affiliate member. And do I believe that the US route is harder? I think both of them are difficult to get into. And I assume your question is directed at surgery. The surgery is competitive worldwide. So I can't really differentiate which one is harder. I know for sure that the US training is faster than the UK. So, but it may take a US-based surgeon 5 years, may take a UK-based surgeon sometimes 7. But it really depends on you, how hard you hustle, and what you do over your training. All right, so how competitive is it to get an internship position after completing MBBS? I'm sure you guys noticed that the amount of medical students is increasing yearly. When I graduated, there was only, I think, 30 candidates. Now there's almost 50 a year. And I believe that our institution is only accredited for 20-something candidates. So it's going to get difficult. Over the last 3 years, we've been seeing that some people may have had to go to Guyana or the Cayman Islands to do their internship because they didn't have any opportunity to do it here. All right, Trey, you said the answer. Yeah, I think I'm answering her right now. Yeah, so I'm going to say it is getting competitive because of the amount of medical students that are graduating each year. So you should make yourself competitive while you're in medical school. Research, do things to build your CV, volunteering, all these things. Because I think you do get interviewed for internship now. Michael Walker, what kind of doctor am I trying to become? A cardiothoracic and general surgeon. We're going to soon get to the Canadian medical examination. Yeah, we're going to get to Canada soon. I'll make sure I haven't missed any questions. Adon, you had any more questions for me? Yeah, we can hear you. Amazing Joey, yes. Liam and Leon, they're actually my nephews. That is a bit random, but yeah. All right, let's see. All right, so I guess we could talk about Canada. Any final questions about the UK? Now, I know there's a forum, the Savvy IMG. You guys can Google that. He has excellent descriptions as well as timelines you could follow for applying to training in the UK. So the Savvy IMG, and I think he spells it SAAVY. So you guys could check it out. He has a good timeline. He has a good description on different routes you can take, whether it's PLAB, whether it's a membership exam, and stuff like that. Adun Abi saying that she cannot hear you. Yeah, I can hear you perfectly. I can hear and see you, yeah. All right, so Dr. Before Mistress has an interesting question. She said Dr. Frey told, I guess, her colleagues that when they did their surgery rotation, that the government pulls the Bahamian students back too soon. He says that the Bahamians do poorly on MBBS exams. And I guess she's asking if we agree. I do not agree. Um, the benefits of training or doing your fourth and fifth year home, you're going to, the patient ratio to the students is going to be better. So you're going to have opportunity to see a lot of pathology. And you pretty much get what you put in. Okay? You know, they say you read for your degree and whatnot. So when you hustle and you study and you pretty much put yourself out there, you go in the wards and you examine patients and you try to understand things as well as comparing it with your own personal academia. You can do very well with. Versus, I think when I was in Jamaica, sometimes we would be on top of each other, like three students seeing one patient because of the increasing size of students compared to patients. But I guess it's pretty much what you put in. It's whatever you put in. You get what you put in. Can you guys hear me? I think Adun. Oh boy. What about now? Can you guys hear me clearly? Can you guys hear me now? Okay. Yeah, I can hear you. Okay. All right. They're saying it's better now. Yeah. Um, all right. Figure that out. I'll just keep talking. I don't think they heard my last statement, but to Doctor Before Mistress, I do not agree with your statement. Um, I think you're going to do as well as you prepare yourself to do. So it really is up to the individual candidate. Um, Medical school is hard. You have to do a lot of work. You have to do a lot of studying. So you pretty much get what you put in. And yeah. All right. So any more questions again? We could hear you, but we can't see you now. All right. So I guess we can go to Canada now. All right, so the Canada's exams is the MCCQEs, is the Medical Council of Canada qualifying examination. It's a two-part exam. The first one is an MCQ. It's actually similar to PLAB, in my opinion. It's an MCQ. I think it's over 4 hours, 196 questions. And then the second part is an OSCE. Can't recall how much stations, but I know it's an OSCE. So you have to do those exams to be eligible to apply to their matching program, which is the CARMS, the Canadian C, small a, and then RMS, the Canadian CA, obviously for Canada, Residency Matching Program. Now, Canada is a bit difficult because they are a country that really prioritizes their nationals. So if you're not a Canadian resident or citizen, you could still be eligible to apply to their matching program, but you're going to need sponsorship from the government that you're coming from. They're not going to give you a salary in Canada if you're not a Canadian national. So you're going to need something called an in-service award, which is something that's provided from the institution that you train or you're currently in. And it's similar to, it sounds similar, pretty similar to the bond that some of you medical students signed. But for an in-service award, usually if you get a year, sorry about that, guys. Yeah, so for the Canadian route, you would need an in-service award. So the institution that you currently work at would have to sponsor you. And usually if they give you a year of in-service, which is essentially paying your salary while you're away, you're going to have to give 2 years back when you return. So if your training takes 5 years when you're in Canada, you're going to be pretty much bonded to the public hospital for 10 years. It does not mean that you cannot do private practice after you finish your program and come back home, but you will be in a sense bonded to the public hospital. You can't just say that you have to leave or you leave the public system entirely. At True and Right, yeah, I work with Dr. Knowles closely. So that's pretty much it for the Canadian route. You take those exams and you apply to the match. It's pretty much a very similar timeline to the US residency match. And you could read about it on their website. But in terms of the resources, they have similar resources to the US, a lot of online references as well as textbooks that you can search and pretty much figure out for yourself. But that's pretty much the Canadian route. It's been kind of hard for internationals to get into Canada because of the stipulations on your your residency as well as your immigration rules and all that stuff. So it's very hard to pursue Canada if you don't have residency at Canada or you're a resident or national of Canada. And even though the in-service route is possible, the current institution doesn't really like to give it much over the last, I think, 10 years. The last surgeon that trained in Canada he probably finished about 10 years ago. So they haven't sent any residents to Canada during that time period. And it's also very competitive depending on the specialty. At Mika Cunningham, yeah, we had a good spread of physicians that matched this year. We had a physician that matched the obstetrics and gynecology, which is extremely impressive. And 5 other physicians that matched internal medicine this year. Yeah, and that's Canada. It's just a general overview of all these things. I would say, obviously, you have to do a lot of your own personal research on the different routes you can take. There's a lot of forums online that can answer a lot of your questions. But Canada is a bit difficult. I would say it's more difficult than the US because of all the stipulations on the immigration laws and, and the in-service thing and getting that straight. So I guess we could switch to the DM programs now. Aduan, can you hear me? We can't hear you. We can't hear you at all. All right, I'll continue talking about the DM programs. So the DM programs are, of course, University of the West Indies based programs. And they have DM programs in surgery, medicine, pediatrics, pathology, anesthesiology, obstetrics and gynecology. Yes, obs and gynae is difficult to match into in the US. It's very competitive. So with the DM programs, usually it's the timeline for some of these programs, that's variable, but for general surgery, it's 5 years. For obstetrics and gynecology, I think it's also 5 years. For anesthesia, I think it's 4 years, but I could be wrong. For internal medicine, it's 4 years. Pediatrics, I believe, is 4 years as well. And family practice is 4 years. And with the DM, usually after your first 2 years of postgraduate training, and this would obviously be in the Bahamas, Jamaica, Trinidad, or Barbados, you would qualify to sit your DM Part 1 exam. And you would have to finish DM Part 1 to become a registrar in those respective specialties. And once you finish your Part 1 exam, you would train for the remaining years and then sit your DM Part 2. Now, as you know, with these DM exams, you only have 2 attempts. So if you qualify to sit DM 1 and you don't pass after your second attempt, you're booted out of the program, essentially. So DM programs are limited in terms of the amount of spots they have to accept applicants. I don't really know what the amount is per year because it tends to fluctuate, but they always say that there's limited spots. And they're very, 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 very hard. Not trying to discourage anybody, but they can be very, very, very difficult in terms of the DM Part 1 and Part 2 examinations. So the DM programs that are offered in the Bahamas, that would be general surgery. You could do the full program here. Cardiothoracic surgery is offered through Jamaica, so you could do the first 2 years in the Bahamas, and then after you pass your DM1, you would have to go to Jamaica to complete the final 4 years, because cardiothoracic is 6 years. Urology is the same thing. You could do the first 2 years here and then do the remaining in Jamaica. DM medicine is done fully in the Bahamas. DM pediatrics is done fully here. DM obstetrics and gynecology is done fully here as well. And just a side note, DM obs and gynae is the only one that allows you to sit DM1 after 1.5 years of training. You don't necessarily have to do the full 2 years. Yeah, the reason why I said DM is very hard, the examinations are very hard for some specialties. Like, I don't know what the pass rate for surgery is, but it's very, very low, in my opinion. And the programs that tend to have very good pass rates based on what I this is pediatrics, as well as obstetrics and gynecology and family medicine. And I think with family medicine, after you finish your second year, you could actually qualify to get a diploma in family practice. And you can finish after your second year and go into private practice with that diploma, or you can continue for the full 4 years in family medicine and get your DM in family medicine. Which is better, PLAB or MRCP? I think if you put in the work and you gain the knowledge to pass MRCP, that would be better because you can still get your GMC license and you would obviously be more advanced in your knowledge base and you would be able to apply for higher qualified positions versus PLAB, you only could apply for a foundation year 2 position, which is essentially your first year as an SHO. So Saunders, would you say applying for the DM program while still trying to match abroad is a good idea? Or would you suggest not joining and just studying around the field you want to pursue? So it's a good question. I was in the DM program during my process of matching. And I guess it's something to fall back on. If your match isn't successful, you can still progress your training. You can still become eligible to sit your Part 1. Do well, invest in yourself and pass, and you could progress and move through the ranks. But you should have a plan on what exactly you want to do. Was it true that they had a whole year that failed the surgery portion of MBBS? I heard that while I was on anesthesia rotation. Controversial question, not going there. Just because you said the pass rate for surgery was very, very low, that's DM surgery. The DM surgery pass rate is known to be very low, and that would be your DM1. Yeah, DM radiology is offered in Jamaica and Trinidad. Yeah, by Julio. Julio is a go-to DM resident in radiology. Okay. Since you started the DM program here, does any credits or time transfer to your new program in the US? No, no credits, no time transfers. So basically, when I start my residency program in July, I will be starting as an intern, so I'll actually be starting over in a sense. In terms of anything transferring, obviously my surgical skills is going to be a little bit more advanced than some of my colleagues, and then my clinical intuition is also going to be a little bit better. But I'll be starting as an intern, so I still have to humble myself and play my role until I'm able to shine and move up the ranks. But it does help to have some training, but it isn't necessary because they have a really good curriculum and they really train residents well. Let's see if we missed any questions. So the whole basis of this forum, guys, whether you want to stay in the country that you're in, as well as whether you want to go abroad, it's just to create a plan for yourself. How long is the program that you're starting? So I got matched to a preliminary general surgery year. So that means that I got offered 1 year and then I would have to reapply. So that's a common route that people take to get into surgery in the US because it's competitive. So during this year, I'll be reapplying. I'll be meeting, more attending, getting better letters of recommendation, as well as doing an in-training exam. And once I do well, I'm going to be a better candidate. So I'll be able to reapply and hopefully get into the full program. Do they recognize DM in the US? If you have your USMLEs and you're DM trained, you would be applicable to do a fellowship in the US. They do recognize postgraduate training, but you would still have to have your USMLEs to be able to apply for a fellowship. But you will not be able to work in the US after you complete the fellowship if you're DM trained, because in order for you to work in the US as an attending, you have to have completion of a residency program in the US. Michael Walker, I'll be training at Morehouse School of Medicine. That's Grady Memorial Hospital. Yes, my program sponsored me a J1 visa. So once in the full program, do you start from intern again? You can start from intern again, or you can actually sometimes match into a PGY2, that's a postgraduate year 2 track. Or sometimes they can even advance you up during the residency, but it all depends. But it's likely that I'll have to reapply in this current match. And possibly likely that I would restart the intern year. Adun, can you hear us? You can hear us? True and Right, would you consider, that's the name of the person, would you consider creating a YouTube channel like Adun to share your experience with others? You have a wealth of knowledge experience that won't be able to share on this live feed. Maybe, but my priorities are elsewhere right now. I just wanted to give you guys a rundown of what to expect and to plan your journey. Everybody's journey is going to be different. With the J1 visa, okay, this is a good question, DOD Esther. So usually with the J1 visa, they give you it for 7 years. And after the 7 years, they would expect you to Well, it depends on your training, actually. So after you finish your training, if it takes up to 7 years or less, they will expect you to return home, I think, for 2 or 3 years to give back to your country. But this can be waived in certain circumstances. Hey, Zola, thanks, man. Zola is a Jamaican infectious disease fellow. Thank you, Jada Saunders. I just want to make sure I didn't miss any questions. Oh, and Satya Boodle, you don't get credits in DM programs, just to clarify that. All right, let's see. Pedro Neely, no, you're not bonded for life. All right. Trey, if I had this knowledge as a first-year medical student, what would your plan be for postgraduate training? So this is a good question. You guys should really think about my response. So if I knew this as a first-year medical student, I would have approached things a lot differently. I would have focused on USMLEs much earlier, so that I would have been able to knock these out during my medical school and be ready to apply either during my final year as a medical student or even during my internship year, just to close the gap of time. So that's a really good question. I think you guys, especially, well, everybody definitely should start this process as soon as possible, so you could pretty much plan out a residency program in the future for yourself. You don't want to, be in the local system too long as a junior doctor. You want to rest and you want to be able to do a career. Okay. Yes, I think for the 2 years in your country, you can then apply for a U.S. position. I think so, but I'm not entirely sure. I think so. But I know you have to, or they expect you to give back for 2 years after you get the J1. But that can be waived. I think certain parameters for waiving it would be working in a rural place in your specialty for maybe 3 years or something like that. Yes, Micah Cunningham, it is super hard to do it during medical school. I agree with that statement, but I believe that a lot of it kind of overlaps. So studying for step 1 during your basic sciences or your preclinical years would definitely increase your knowledge bases. It is hard, I can't deny that, but it's possible. I have colleagues that have done it, and they're, like, I have a colleague that did it. I think he finished his final USMLE while he was an intern. He's now a PGY2 in general surgery. So it helps to finish these things. I know it's difficult. I know it's hard. I know it's a lot of financial restrictions for some people, but it's possible. All of these things are possible. And yes, Ramika role, it is extremely hard while you're working, especially if you work in a very busy department. Well, actually, if you work in any department, it's going to be hard because you kind of, you're dealing with patients. You have to prioritize your patients. You have to make sure they're good. You can't put them on the back burner for yourself. You can't be selfish all the time, but it's definitely going to be hard. It's hard, but it's possible. Okay. Make a plan. You have to make a plan, a nice structured plan, so you can figure out what you want to do. You don't want to be figuring this out while you're working. It's going to be difficult, but even with that being said, it's still possible. Some people in 5th year and still undecided what area especially they want to do. It's very hard to plan with everything. That's true. That's true. So it would definitely be better if you have an idea of what exactly you want to do. But I guess that's a special circumstance when you're trying to figure it out. All right, so should step 2 CKCS be taken in year 4, year 5, or internship? Yeah, the earliest you can take it is better, in my opinion. When would you take step 3? Step 3 isn't necessarily vital for the match. They give you up until a year, sometimes 18 months, depending on the program, after you match to do it. But it would be helpful as an IMG, in my opinion. Is there any other advice you would give the first-year medical students? Yeah, it's a lot of work. You got to study, but you got to find a balance. That's pretty much for everybody. You got to find a study life balance as well as a work life balance for the people that are working. You got to, maintain your own sanity. Don't get too caught up. Make friends. You're going to meet a lot of lovely people in whatever institution you're at. So, and they're going to encourage you and, be very uplifting. So definitely find a balance. Do you think it's a disadvantage to apply to the match while not working in the medical field? If you're eligible for the match and you're interested in training and doing residency, even though you're not working, yeah, you should still apply. Why not? At what point did you know you wanted to do surgery? Cardiovascular anatomy. I think that's year 2. That's when I knew I wanted to be a surgeon. If you had to do it all again and could afford to, would you sit out internship year and just study for USMLEs and go from there? Yeah, I think I would, but yeah, I honestly think I would sit out internship year. But internship year is beneficial. It's a lot of work, but yeah, I would sit out internship year to focus on the USMLEs. But I wouldn't want that gap to be too long. I wouldn't want to be out of the working environment for too long. So obviously, if you're not working, you're gonna have a lot of free time. You may be able to cut those months in half and get the work done. So definitely, yeah, I would sit out internship. Yeah, if I could repeat it all over again. What would you say to skip an intern? Yeah, and just studying to take your exams. I would consider it. Yeah. One publication I got during my undergrad, and then the other while I was in SHO. I don't know what Josiah Ojo Dare is saying, but okay. Okay. All right. Let's see if we're missing any questions. Any more questions, guys? It's been like an hour and almost 40 minutes. This has been going. We'll call it doing and see where she is. All right, so I was on the phone with Adun. I think she's having some technical difficulties. But at Xenocon, my ultimate plan after Morehouse, sorry for the echo. Well, I would like to finish my general surgery training there. and then pursue a fellowship in cardiothoracic surgery. Considering the US for that, even the UK, seeing that I can work there. I don't think I'm gonna come home right away. I'm probably gonna spend some time in the US if I could, just to improve my skills. So when I come back, I know that by the time I come back, it should only be me and another guy in thoracic surgery. So we're pretty much going to be spearheading that. So I want to, have my skills up to par before I come back and be able to take on that burden by, with just me and another guy. I completed the publication with a consultant as well as another resident. What advice would you give for conducting research? Tie yourself with a consultant. There's a lot of consultants that I've worked with that are very interested in research, so they'll extend that opportunity to you guys if you show you're interested. And Michael Walker, no, I'm a Bahamian. No, I did my electives in Jamaica and in the Bahamas. Yes, during the residency program, you do get paid in the US. Yes, I was extremely happy with where I matched at Doctor Before Mistress. That was my top choice. All right, thank you, Esther. Appreciate it. God bless you too. All right, guys, let me know if you have any more questions. I think we pretty much covered what we intended to during this forum. Ask away now. Adun is going to share my email with you guys, so you guys can ask me any questions. It's a good idea, Micah. Yeah, there's a lot of consultants like Dr. Francis, Dr. Farquharson. They're very much into research. For your senior elective or any of your electives, if you're interested in pursuing training in the US, I would recommend you go abroad. Definitely. So that could be a representation of US clinical experience. At Mike and no, I did not have any US clinical experience before applying. No problem, Gina. Okay, the interview process, it was fun. The programs, they're very, very excited that you're there. They're very welcoming. They give you a tour of the place, and every program is different, so the amount of interviewers would change. And they're very friendly. It's initially a bit nerve-wracking, but it gets better. Thank you, Micah. Thank you, Michael. No prob, Deanne. Yeah, wait, Sean. All right, if you guys have any more questions, let me know. And Adun would share my email contact with you guys if you have any further questions. I hope this was informative. I hope I didn't waste your time. And study hard, make a plan. No problem, Doctor. No problem, Keisha. No problem, Simone. No problem, Laptis. No problem, guys. No problem.